The United Nations and the World Bank Group have launched a $1.2 billion fund to invest in healthcare for mothers and children in developing countries as part of a drive to end their preventable death by 2030. The global financing facility will provide capital for poor countries to develop their healthcare systems and collect better data on birth and death. Partners include Norway, the United States, the private sector, and nonprofits. Child mortality has plunged since the UN set a development goal of reducing under age 5 death worldwide by 2/3 in the last decade. Maternal mortality had dropped by 45% since 1990. Yet the mortality rate in poorer countries is still 14 times higher than in the developed world. Jim Young Kim is president of the World Bank Group.
The global financing facility unifies resources from international donors, the private sector, and developing countries with a goal to end preventable maternal and child deaths by 2030. It has the flexibility to finance investments in other sectors, such as education, water, and sanitation, if they have a significant impact on our goal. And the GFF uses innovative financing mechanisms to increase funding for national strategies that will improve women's and children's health.
And some 190 nations hope to agree on how to bankroll 17 Sustainable Development Goals by 2030. The SDGs, expected to be adopted in September, are estimated to cost between $3.3 and $4.5 trillion a year. Now, the Rollback Malaria Partnership recently released a new strategies to guide efforts toward malaria elimination by 2030. Progress in the fight against malaria since 2000 has resulted in a 58% reduction in malaria mortality. More than 6.2 million malaria deaths have been averted between 2001 and 2015. However, malaria remains a major cause of death in developing countries. The WHO estimates that there will be 214 million cases of malaria infection in 2015, claiming the lives of approximately 472,000 people, the majority of them African children under age 5. Experts say malaria reduction and elimination will be critical to the achievement of the Sustainable Development Goals. 500,000 people suffer spinal cord injuries each year due to car accidents, serious falls, and diseases, according to the World Health Organization. Researchers are now working on a soft but strong spinal cord implant that could one day restore movement in paralyzed individuals. VOA's Maya Puchara reports.
6 weeks ago, this rat was unable to move. Its spinal cord completely severed, but it's walking today, held upright by a harness. Scientists in Switzerland developed an implant that supplies the rat's damaged spine with chemical and electrical stimulation. That heals the nerves and restores movement. Stephanie Lacour, an assistant professor at the Swiss Federal Institute of Technology in Lausanne, tested the implant and saw encouraging results.
By combining this electrochemical stimulation of the spinal cord tissue, we then tested whether or not we could restore locomotion in the hind limbs. And this is what we found, is that indeed we can, using this technology, we were able over weeks of time to stimulate the spinal cord in spinal cord injured animals and allow them to walk.
This new implant, called E-Dura, is a flexible solution to inflamed tissue and damage caused by older technology. Stiff implants, which rubbed against the outermost layer of the rat's spinal cord.
We wanted an implant that could stay quite some time in vivo without inducing any detrimental effect. And so the first question we asked was, is soft making a difference?
She says it is. E-Dura is made of soft, stretchy but strong silicone that has two unique features. A microchannel allows researchers to inject drugs directly to the surface of the spinal cord for chemical stimulation, and stretchable platinum electrodes connected by gold tracks make the implant able to withstand big twists and turns as it stimulates spinal cord nerves electrically. E-Dura only restores involuntary movement. For the rat to be able to walk without a harness, the regenerated spinal cord nerves need to talk to the motor cortex, the part of the brain that controls voluntary movement.
There's no link at the moment between the brain, so the motor command, and the actual stimulation pattern on the spinal cord. So we now also have to find a way to link the two so that the person will think about moving and indeed the stimulation will be synchronized.
Creating this link in rats may be the next big leap in making E-Dura a safe and effective treatment for people who are bound to their wheelchairs, waiting to move again. Maya Pajara, VOA News, Washington.